Hello, I'm Kenneth Cutbush, an orthopaedic shoulder surgeon working in Brisbane. I'm with Lucy Angelini, a shoulder physiotherapist. Have you had surgery and your shoulder's tight and your range of motion hasn't come back, and we're talking 12 months down the track? There is something we can do. We can release it for you, and we're going to talk now about what you're up for after the surgery, what you're actually getting yourself into. So Lucy, these are patients typically who've had a rotator cuff repair, or they've had stabilization surgery to tighten the shoulder up because it's coming out, and they've formed scar tissue where we don't want it. It's a small percentage, and that's tethering their shoulder and stopping them from getting their range of motion back. And what I do is, we'll normally be doing this at 12 months. I think at 6 months it's too early to contemplate because so many patients will get their range of motion back between 6 and 12 months. So we need to be patient and see where we are at 12 months. And at 12 months is a good time to think about doing the surgery. Surgery will involve arthroscopic surgery to take down the scar tissue and free up the shoulder so that you can get your range of motion back. And that needs to be thoughtful about the surgery you've had previously, the rotator cuff repair or stabilization surgery. We don't want to reprecipitate problems we don't need to. And in theatre, I will take a video before the operation showing the range of motion, and then at the end of the operation showing the improvement in the range of motion. And normally it's dramatic. Normally we get your range of motion back in theatre, at least 90% of it. The difficulty then is keeping that after the operation and keeping that range of motion that I get for you in theatre. And that's where the physios are really important, really come into play with this procedure. So you'll typically be in hospital overnight. The next morning, the nurses will see you and change your dressings, usually after the physio sees you actually. You're getting out of hospital at 10 a.m. We're not wanting you to, you'll have a sling just for comfort at that first night, but we don't want you to wear it. We want to get you moving with the shoulder. So Lucy, take us through that first visit in hospital with the hospital physio.
So it's the afternoon of surgery.
Oh, that's right, yes. I didn't mention that. We do it in the morning, and the first time the physio sees you is that afternoon.
Yes.
Because we want you to see that range of motion we've got for you while the block or the pain pump's still working.
Yes.
And again, the next morning. So that afternoon.
So you're still in bed, you've come out of recovery, and the physios will come. It seems a bit aggressive, but that's the point.
Yeah.
And so we want to maintain the range of motion that you've been able to achieve. So we start stretching you. So we hands-on get in there and give you a really nice stretch just to show you that it's safe and this is actually what we want to do. So there are no restrictions. There's nothing we're trying to protect. We need to get you moving. So we'll do some hands-on stretching, and then the next morning, once you've had your first night, we'll instruct you in a range of motion program that you'll do religiously 3 to 5 times a day, but you'll also see your local physio quite regularly because it requires a lot of sort of hands-on manual stretching for you to maintain this range of motion as the body tries to heal.
That after that visit that afternoon in hospital, which we don't do for any of the other shoulder surgery, do we? But it's such a rewarding experience for you to see the range of motion that you've got after the operation. And from my point of view, I see people believe in the operation then. They're not quite sure about it until then they actually see the range of motion, and it's a really big thing, isn't it?
It's huge, It's my favourite.
Your favourite.
Yeah, I love it. It's great.
And so that will happen again the next morning. The nurse will change your dressings, and you're out about 10 a.m. So no sling from there. You can start driving when you're up to it. When you can safely control the car is when you can start driving. It's usually in a few days, maybe a week. Yes. So and we get them to see their physio pretty frequently, don't we?
Yes, very frequently. And in hospital, you'll also be given a foam bolster to sleep with at night, because we really want to avoid this internally rotated position. So we want you to keep your arm away from your tummy as much as possible. So either with pillows or the bolster at night, and then during the day, trying to keep it away from your tummy.
Yeah, this is a really important concept. The concept is that the range of motion has been got for you in theatre by releasing the scar tissue and freeing up the normal shoulder tissues. And if I put you into a sling for 6 weeks afterwards and rested you up, it would just tighten straight back up to where it was. The difference is that after this, because you've had surgery before and been put in a sling, you have to, because you have to protect those repairs. But this time, because that's all healed and that's fine, we can now move you straight away. So the shoulder, it will still want to form scar tissue because that's your shoulder. But the difference is we're moving you and we're avoiding leaving you like this, so that when your shoulder does heal, the scar tissue doesn't heal tight and contracted. And so that's the big difference. We want you to move, and we want you to sleep at night time not like this. We want preferably out like this if you can. So most of the time doing things with it and keeping that shoulder moving so that the scar tissue can't tighten up and freeze your shoulder up again. So 2 to 3 times a week.
Yes, a couple
To
of times
start
a
with?
week for a really good stretch. It's just easier if you're able to relax and someone else can stretch your arm for you. And making sure that you doing exercises at home. So your physio will measure your range of motion each time you go in, so you can objectively see where you're at.
Yeah, I think that's a big part of the physio too, because it's pretty hard to work out yourself how you're going, and the physio is really good at doing that and giving you some appropriate feedback as to where you are.
We do like measuring things.
So we see them back at 6 weeks. What do we do then?
So at 6 weeks, yes, we have a look at your range of motion. And if your shoulder's pretty comfortable and your range is returning, then we can look at starting some strengthening as well, which is often good prehab for, getting yourself back to, your sport, getting you back to the gym, getting you back to work, whatever you need to do.
Yeah.
Yeah.
And often that's it, isn't it, from my point of view, because my bit is done, and then you just need to keep going with your physio.
Yeah.
If the shoulder's sore, think about getting cortisone injection to the shoulder to help help the comfort of the shoulder and help you with your rehab. And that's a big thing, isn't it? It's usually a pretty rewarding experience.
It is. And it's so different from the first surgery that you've had, which often puts people off because, when they say shoulder surgery, they think they're signing up for the same thing again, but it's completely different. Yeah, it's a different experience, much more positive.
Yeah, yes. I think that's an important takeaway. So if you have had surgery and your shoulder's really stuck and tight and you're 12 months or more down the track, then this is something that is possible to do for you, and it makes a big difference to people. Thank you for listening.